Okay, welcome back friends. In this video tutorial, we will going to discuss about Japanese encephalitis in very details. So, Japanese encephalitis is the leading cause of vaccine-prevented virus encephalitis in Asia and Western Pacific. So, this is important point: vaccine-preventable encephalitis. Okay, so for most travelers to the Asia, the risk factors for encephalitis is very low, but it often varies depending upon the destination, length of the travel season and activities. Most people infected with JE, that is the short form of Japanese encephalitis, are asymptomatic. Okay, some of them may develop symptoms which is mild symptoms, and less than 1% of the people develop inflammation in the brain, that is what we call as encephalitis. Okay, with symptoms including sudden onset of the headache, high fever, disorientation, coma, tremors and convulsions. About 1 out of 4 cases are fatal in case of Japanese encephalitis infection. So to prevent sick from JE, we can use EPA registered insect repellent, and we can wear long sleeve shirts and long pants, and we can get vaccinated. So now the question is, why I am telling you to use insect repellents? Because although your Japanese encephalitis virus is a virus, it is a viral infection, but it is transmitted through mosquitoes. Okay, it is not directly transmitted inside the human. Here mosquito play the role of the vector. Okay, and mainly the Culex species mosquito named Culex tritaniorhynchus. Okay, so our first goal should be to protect ourselves from mosquito biting. Okay, so that is the reason why it is often recommended to use insect repellents and to use or wear long sleeve shirts and long pants for protect yourself from mosquito. Okay, now Japanese encephalitis virus is a flavivirus and is closely related to West Nile and St. Louis encephalitis virus. So this JE virus is particularly transmitted to human through bite of infected Culex species mosquito, especially Culex tritaniorhynchus. I have previously told you. So JE virus is usually maintained between mosquito and vertebrate host. Okay. Now, if you watch this picture, so here the main or primary host for the virus is the water bird. Okay, they are amplifying or reservoir host. Okay, so the main cycle is between Culex mosquito and water birds, and humans, horses and pigs. Also pigs are also a amplifying host, but horses and humans are dead in host or incident host. So what is the meaning of dead in host or incident host? The dead in host or incident host means inside those hosts they do not develop high enough concentration to infect a feeding mosquito. Okay, that is why the name dead in host. That means now it is time to end the life cycle of the virus. Okay, so now JE virus transmission occur in rural agricultural areas, often associated with rice production and flooding irrigation. In some areas of the Asia, this condition even occur in near urban areas. So remember, in temperate areas of the Asia, JE virus is seasonal. That means JE virus infection takes its peak in temperate areas, especially in the summer and fall. Okay, but in subtropic and tropical areas, the virus transmission is year round and often with a peak, especially in rainy season. Okay, so now symptoms. So as it is a encephalitis, we are talking about this virus as encephalitis virus, so it will target the brain. Okay, so all the symptoms that you will observe will be brain related. So most of the people are asymptomatic or develop mild symptoms. In some cases they develop symptoms and the proportion is less than 1%. Okay, and those who develop symptoms, for them the incubation period is 5 to 15 days. Now what is the incubation period? Incubation period is the time frame between the infection and the development of illness. So initial symptoms include fever, headache and vomiting. Then the characteristic symptoms such as mental status changes, neurological disorders, weakness and movement disorders might also develop. Seizures are commonly observed in case of children. Okay, so that is the important symptoms that you should remember: fever, headache, vomiting as the initial symptom, then mental status change, then your weakness, movement disorders, neurological disorders, along with seizures, especially in children. Treatment: no treatment is available for JE virus. That is a quite unfortunate thing. Now hospitalization is necessary for supportive care and for close observation of the patient. Treatment is symptomatic, meaning the main goal of treatment is to reduce the symptoms. It includes rest, fluid, use of pain relievers and medication that will relieve some symptoms. Okay, so prevention, as it is a mosquito, so as in this infection mosquito play the role of vector, so our initial goal should be to prevent mosquito bite. That is why we will use insect repellent, mosquito netting, we will use full sleeve shirt or full pant, and then important is the vaccination. Okay, so inactivated varicose culture derived Japanese encephalitis vaccine is available. This is the only type of vaccine available in the US and it is manufactured by Ixiaro. So it is the only type of JE vaccines available and it is given as a 2-dose series with the dose spaced 20 days apart. Okay, so that's the video for Japanese encephalitis. So this is the ending of our disease lecture series where we have talked about bacterial disease, viral disease, fungal disease and protozoal disease. Okay, so I hope these videos will be helpful for you. Now thank you for listening to this class.